What is up, YouTube? We are here doing a mukbang, whatever it's called. Jameson, you still in all my light. Okay, here we go. This is my cousin Nikki and the lovely baby J. And today we're gonna be eating seafood and chicken tenders.
It's got legs on it, bro.
Please disregard her. She didn't know her shrimp came with legs. You gotta peel it.
Ooh, it's swimming still out of the ocean. All right,
So,
bro. How to take the shell off?
You have to. You have to peel it,
Where?
like from the bottom.
Ooh.
Why did you get this?
Because, girl, most shrimp places.
I don't think we'll ever get to the video.
All right, most shrimp places. Okay.
No, boiled comes like that.
This is terrible. I'll never do that again. This is why I didn't get crawfish. You remember that one time you had a crawfish boil at your house and like your mom literally had to peel all of them for me?
Well, this is what you're gonna have to do. Jameson, you still on my light. Okay.
Oh, because
all
he wants this. Here, baby. That's my brother calling.
All right, we'll be back. And we're back.
Ooh. Technical shrimp difficulties. For real.
So today we're gonna be talking about what it's like to be an MA. I have two feelings about it. Some days I like it, some days I don't.
I'm about the same. I feel like MAs are underrated for all the things that we do for providers and our clinicians that we work for.
True. You want some?
There's a lot of stuff that goes on behind the scenes that make a doctor's office work. And of course, we give props to our doctors, our amazing clinicians that are out there. But there's a lot of stuff that gets overlooked that we do.
I feel like it's like, this is like a really wild number, but it's really like 25% them, 75% us.
No, those are facts.
That's a really high number, but I swear, like, they just come in and give y'all the diagnosis, but anything else after that, we have to do it. Like, if you need a shot, we gotta do it.
We put in your orders.
We room you.
We send over your prescriptions to the pharmacy.
And when y'all be calling, we answer the phone to do all that. So I mean, that might be a high number to some people.
We make sure your labs come in.
We draw your labs.
We sure do. What else do we do?
We tell you your labs after they read them.
That's right. Of course, the doctor always oversees everything that we do. You know, they're like the all-watching eye, but really,
we do a lot of the work.
Yes.
I feel like we're underpaid for it too.
Oh, hell yeah.
A lot of people always ask about pay. And it was straight when I first got in the game because of course it was higher than what I was getting paid at the time, but now underpaid.
Then think about all those student loans that we took out to get into this field. And so it's like struggling in today's society for us to live off an MA's wage, pay off our student loans by ourselves, and live in a decent area.
And still go back to school again. With
Super
more
hard.
student loans.
With more student loans.
I feel like my MA loan, come on Jamie, let's tell the people. I feel like my MA loan was like really a waste. Like if I really could have put that towards my RM, if I could go back and tell myself to do that, I really would. $20,000 to be an MA?
No, really 22, because we got our X-ray tech degree and everything else alongside of it.
It was not worth it.
And I'll tell anyone straight up, if you're thinking about going into nursing and you want to see the field, go straight into nursing, because that 20 grand could be used on a semester somewhere else.
No cap, but for real. Like I wish I would have used my $20,000 differently.
But I mean, on the upper hand is that we do know a lot of things: blood draws, EKGs, vitals, and stuff that you know, we will be ahead of the curve if like she's starting her clinical nursing core pretty soon,
2021.
so she will be in there and she will kind of already be ahead of the curve for people that don't really know what to do because she does it on a daily basis.
I mean, yeah, it has its ups and its downs.
But what we get paid is a down.
Definitely, we do a lot more than what we should be paid for. I know people who started the same time as me and got paid less than me because they went into private practice. That's another thing. It's a really big difference between private practices and companies. Like, from what I heard, what these private practices go through, as much as I be going through in my company, I'm glad I'm with the company. Like, my PTO started day 1. And there's a lot more people in the office. So if Susan and Jane is off, that don't mean that I don't have to not be off because 2 people are off and it's only 3 people in the office. So that's another part that I like.
I've worked for a private practice and to put it shortly, it was a hot mess. One, the office wasn't together. Not trying to throw no shade because my MA that I worked with, I love her to death. I still talk to her to this day. Like, she was fantastic, but just the office setting was not a good positive one to be around, and patient care was definitely not priority. Oh, hey, yeah. I'm gonna back up. You see what I got?
So it's a big difference. I mean, I would never stray anybody from their path, but every time y'all be in my comments asking me, I tell y'all, you want to be a nurse, be a LVN. It's like half a regret for me because who's getting hired now? MAs or LVNs?
LVNs, because ain't nobody want an MA. And it's sad to say because depending who you work for, a lot of those doctors give you nurses that like LVNs or RNs would do if you train underneath them and you guys have been like together for a certain period of time. So there's some MAs who do sutures. There's some MAs who do certain procedures with doctors because they've worked with that doctor for X, Y, and Z for so long.
Yeah, true. Like, when I had to go sub at this clinic, they were doing staple. The MA did staple removals.
I did staple removals.
Never done.
For C-sections, we would remove the staples. I'll tell you, my first one, I was really nervous, but it's pretty easy. I'm not gonna lie, it's kind of fun seeing those things like pop out. They're not that bad now when it's infected. That's
we did one and like
terrible.
The way she did it, it like pushed it into the lady's skin, so it was like horrible. And that was my first time, so it kind of scared me. I don't ever think I want to do a staple removal.
It's not as bad as it seems.
And y'all always ask about labs. Yes, we draw. Did you draw labs? I draw labs.
No, I didn't draw labs. Well, we had a lab tech lady. Ooh, we've had some issues with Quest. Like, not trying to throw no shade, but our lab lady was just. We had finally got a new one because the one that we had before like walked out.
What?
She didn't want to draw no more labs. But usually we'd have our on tech phlebotomist who would do our labs and then send them off. But if that was not the case, then of course we might have to get up in there and do a little blood draw, do a little stick.
Where I'm at now, we do like our own blood draws. Like every blood draw that comes in, we do it.
Well, it was juicy. Don't get on my shirt. It already did.
But it really depends on like what clinic you go to and how they do it. Because the clinic I was at before, they had their own lab. Ooh. We running. They had their own lab. Hold on, Jameson, you can't put that in there. You don't right here, bud. Right here. There you go. So they had their own lab. So we just send our patients over there to their lab. I don't think you'll like that. It's pretty hot. There you go.
This hot? It's hot.
Yeah, that's why I don't get hot. But yeah, It really just depends on where you go, what they're looking for, what they need. Cause I used to go
you got
in
ketchup over there?
with
I think he wants ketchup. He's trying to dip it in something.
It got hot sauce in it. I mix hot sauce and ketchup.
So you just used all the ketchup.
They didn't put any in your bag? I hear something at the bottom.
I thought it was all the same time.
I'm pretty sure it's ketchup.
Oh, okay. That's a bit.
But I forgot what I was even saying.
What was that? What was that? You fart? Oh my god! Bubba. Oh, snap.
But it all depends really where you go, what they're looking for, what they need. I go in with, well, I used to go in with my provider to do different type of like surgeries, and not like major surgeries, but like little things like EMVs, and we going on leaps, copos, IUD insertions.
And I'll tell you what, those IUD insertions made me not want to get one.
Yeah, I've seen it, and I'm definitely not gonna ever get one. I was never interested before, but I'm definitely not interested now.
Facts.
No, thank you, Jameson. Oh, no thanks. Yeah, there you go. Yeah. But yeah, I mean, like you said, it has its ups and downs. People have been in the field for like years and years and years. I do not. And I will not see myself in the MA field for years and years and years, because it's just not my speed personally. Like, it's really my motivation to keep going.
A stepping stone.
And that's exactly
literally what our college said it was.
Like, this is not going to be my career. It can't be my career. I think I would start doing something else if I ever tried to make that career.
It's not for everybody. And you know what? For the people that are like saluting to the MAs out there who are still seeing patients during this epidemic, like, it's amazing. The women that are pregnant and are still getting seen by physicians, or the people that need therapy and are still being seen by their PTs, like, it's amazing. So we salute you guys for sure.
For real, because we really are the front line. We see the patients before the doctor even see the patients. We get cooped up in a room with the patients before the doctor even see the patients. So
I've had patients come in with like strep and pneumonia and like they don't tell us till after the fact that we've already like touched them, done their vitals, and been face to face, you know, not 6 feet apart, but literally maybe 2 or 3.
Coughing, didn't cover their mouth.
Yeah.
Didn't say excuse me. Like, we are really the front line to all of that. And it's really crazy because we don't get paid enough.
Not at all. But, you know, I would say the patient interaction is what makes it all worth it.
No cap. I've met a lot of people that way. Like, I have like people, patients that are like family to me. Like, we got phone numbers. Like,
I can definitely say the same. I met some wonderful people through the practices that I've worked with, and I've been ultimately blessed to know them and still be in contact with them. So it's not all bad being an MA. There are some awesome qualities. You even work with some really cool providers, and you learn really cool procedures and things that like you would not ever dream about just going day to day in an office wearing khakis or, you know, a button down shirt. It's definitely hands-on. You've got to be proactive. You've got to be on your money. If you're not, you'll be left behind, because most of these practices are fast-paced.
literally. Like, you get like 1 week of training, if that, and then boom, you on the floor. Like, you better grab it and go, because that's all the time you get. But it's really not that bad once you get the swing of it. And let them know, Jamie, it's not that bad. Once you get the swing of it and you get your own flow, like, it goes by. Like, this will be my 3rd year. Like, I feel like we just, please don't fall. And we just graduated. And we're already on year 3. Year 3? Let them know. We on year 3 and we're already back in nursing school.
So, hey, calm down. Hey, calm down. Don't fall. Hey. box on me, bro. Calm down.
Jamie, let's get it together for the people, okay?
Jamie.
Where you going? He don't want to be in the video no more.
You gonna go? Whoa, what's up with your mouth? Ask your auntie to grab your juice box. Oh my god, well, I knew that was gonna happen. Oh, he wanna get down. Alright, Bubba.
But yeah, it's not all bad. It is a learning, like, and if you can, don't go in being no rude person who don't talk to people and don't make relationships, because you are definitely gonna need, especially that doctor relationship, when you need those recommendations, because that's what really counts. Especially going into nursing school or other ventures that you want to do in your life. That doctor's recommendation, that's the one that hits. Like, because I have a couple of doctors from my old job that will still put in recommendations for me. Like, when I go over there, like, we still have talks about life and how we're doing, and if I ever needed anything. Like, I didn't burn my bridge when I left that place. And that's one thing you cannot do, is burn bridges, because you never know.
Or you might need them.
The medical field may seem big, but it's really small.
Oh, the truth, because all these doctors know each other because they went to school with each other. I mean, I worked with a physician, across town, like miles away, and they were like, oh, you know so-and-so? How was working with so-and-so? I loved so-and-so in college. And I'm like, oh, you know so-and-so? Oh,
Jamie.
Baba. And they're like, oh, I loved so-and-so. Like, I'm going to call so-and-so right now because you just made me think about him. And then all of a sudden they're talking.
Yeah, so like,
and they're asking about you. And they're asking how you did in your work field. So everybody knows each other. So you got to be
and
careful.
People talk. Let you have an attitude or let you not like to do something. Oh, they let them know.
Let you not come in on time.
So-and-so is always late. So-and-so always got an attitude. So-and-so blah, blah, blah. Like,
never wants to do anything extra.
So-and-so is going to leave at time, on the clock, no OT, don't never want to help.
Y'all know them coworkers that be like, we know she not doing no OT, she's gone. We know people like that.
You got to be careful of that, because like it may seem like a big deal, but it is really not. Like, people know people.
And that shit will follow you into nursing, like when you're ready to start a hospital, because the majority of them have worked at that hospital and then branched off and went somewhere else. Or most of these clinicians do work in hospitals, so they still see your labor and delivery floor, or, you know, certain whatever, you know, specialty they're in there. They still are in that hospital. So you don't want to get around as the person that don't like to do anything.
Because it will be known. And they will label you as that.
Everybody's going to be like, oh, there goes that lazy nurse. I knew when I gave birth to my son. I remember this nurse's name, and I'm not going to say it, but she left an impression on me. Whew. Lord have mercy.
And that's the thing, like, okay, let me tell y'all. So I usually don't get fly with patients unless they get fly with me. Like, I'm always good-spirited at work. But, like, once you have one time, and I think it's the Taurus in me. All right, Jamie, can I talk? All right. I think it's the Taurus in me, but like, you only got one time, like. All right. You don't want me to tell these people about my bad attitude, then I won't.
Let me get one more juice or something, Bubba.
So,
we ran out.
again, I think it's really the Taurus in me, but I have like, you have one time, like after I'm nice, and then you don't treat me nice, or you give me an attitude for no reason. It's like, all right, you finna get the same thing back. So, but it's like,
don't drink such juice.
It really leaves an impression on the patient, because I could give you an attitude and not even remember you the next visit. But when Karen comes back and we had that encounter, Karen is going to remember that. It's like, you can't be mean to people. Like, even though we're never gonna remember these people. Even though we see like 20 people a day, every day of the week, you are not gonna remember these people, but they will remember you. Impressions last. Like, that is the biggest thing. Impressions last. Karen will definitely bring it up.
Oh, and she will snitch. So unless you want to get in trouble with your doctor, cut it out. But sometimes there be patients who just like to act an ass.
And your doctor knows this, so if you have to get flied, they'll write it off.
Because they know that XYZ patient is a patient that likes to go off the handle.
And usually they let you know, like, well, if you cool with your doctor, they'll let you know. They'll be like, hey, such and such, this is how such and such act. This is what such and such does every time she come in here. Don't take it personal.
And please do not trigger her. Try your best to avoid that. But, I mean, at the same time, you've got to stick up for yourself in that kind of field and not let people walk over you, because if they see that they can, they will.
And they will do it repeatedly.
Mm-hmm.
Especially with them refills.
And they know they haven't seen the doctor in 2 years.
And then pain pills that they know they can't get no refills on.
That's just hilarious to me.
That one thing. People on their pain medication, you don't want to play with that.
Or you have some people that don't even know what they have, but they're like, oh, I need this medicine because I know it's going to cure me. And you're like, but you haven't seen a doctor, so how do you... I just know. And I'm going to say this, guys, like, not saying that you don't know your own body, but you really don't know what it could possibly be until you have someone, you know, evaluate you and send your lab off. I mean, because we could think it's something and it's completely different and we treat you for it and it makes it worse. And now you're calling our office saying, well, you gave me this and it's your fault because it's worse. And it's not worse, but you said you knew your body. And
because patients show, well, I had strep throat last time and this feels like strep throat again. So can I get that augmentin to Ann? Ma'am, you ain't even had a strep test. We don't even know if you really got strep. What if you just got a sore throat and you really don't even need it? Like, patients are quick to, I know my body. I had strep last time, so this is what it feels like.
How are you going to tell me? Well, I'm not telling you. I'm just suggesting that you might want to come in. The doctor would recommend that you come in just so we make sure that you're all good.
And then you have the people who don't never want to come in.
We need a bed.
We have those people who don't never want to come in, but I always want something sent to the pharmacy. Like, no, ma'am, he can't send in your high blood pressure medication because we don't even know what your blood pressure. We don't even know what your blood pressure is measuring.
Last time I came in, it was like 140 over 160. Well, so it's okay. I know I can have this. No, sir. And when the last time you came in was like a year ago. What the? Here you go. Here you go.
Oh, Jamie, we're going to give you some spotlight. Come on. Okay, Jamie wants his spotlight, y'all. Talk to the people. Oh!
the trash. Just look at it.
All right. Talk to the people, Jamie. All right. We haven't technical difficulties. There we go. Oh, you let the people know.
Damn. I'm going to shift the table this way.
I mean, I really can't remember the questions y'all be asking. That's why I asked y'all to ask me on Instagram so I can have a list. So next video will be like a lot more organized. You guys. All right.
Oh, damn.
Oh my God. Oh,
it's hard having a kid.
All right. So next time when we come with the video,
Come here, Bubba.
we're gonna have specific things to talk about, but this is really just our overview of how we feel about like being an MA altogether.
Dude, we come from a family of MAs, really.
Yeah.
And LVNs and nurses. So I would really say like the majority of our family is in healthcare.
So it's like written in the stars basically for us to be in healthcare.
He's sad. He doesn't want to be in there. Look, he's like...
He want to be in front of the people. You want to give the people life. Yeah.
And his shirt's dirty. We can't give people life with his shirt and clothes dirty. We gotta use a whole new video. He had a mukbang too, and he's all messy. Guys, that was from his ravioli a couple hours ago. He gets messy.
But yeah, I'm pretty full already.
Well, I am not, because I've been tending to my kid.
She's only had one crab leg and one shrimp.
How many have you had?
Maybe like 4. He wants to talk to the people. But yeah, basically, that is the video. Like, would I recommend being an MA? It's a 5 out of 10 for me. It can go either way, in my opinion. It is what you make it. This wasn't made for me, so my recommendation is a 5 out of 10.
You didn't want ketchup, but you wanted ketchup.
He's looking like it's foreign.
Would I recommend it?
It's a long pause.
Well, no, I'm just really thinking about it to give my genuine opinion. Opinion, yes, opinion. I would say, if that is all that you're thinking about doing, and you know there's certain things that you're not going to want to do as a nurse, and you're okay with making $20 or less.
Oh, sorry, we gotta.
And you're okay with making $20 or less, then go by all means do it. If
I agree. If that's what you want your last step to be, then it's a cool field. But if that's not where you want your step, like if you really know that you want to be a nurse,
then don't do it. There's so much more that money could go to, and that you can do. Putting greatness in this world, and it's not saying MAs don't put greatness in this world, because we do. Like I said, we do a lot of things that make the office run.
I think that's my other thing. I feel like it isn't patient cared enough of what I want to do. Like, I want to care for people, not just room people. I feel like that's how I feel about MA. I feel like it's not hands-on. I'm not like, I don't feel like I'm making a difference, basically. I don't feel like I'm making a difference. Like, I'm really just roaming you, getting your vitals, and then that's the end of our encounter, and whatever else is ordered after that. But I just don't feel like I'm making a difference, and I think that's my problem. See, there we go. 26 minutes into the video, and here we go.
You realized your purpose?
This is my problem with being an MA. Yes. I don't feel like I'm making a difference yet. And I think that's really why I got into the field, because I want to make a difference in patients' lives. And I feel like I can do that for MA.
You're really strong, guy. What's happening? Yeah, and I would definitely say you do make a difference in the office setting, but your impact on what you do is not as significant if you would have your nursing degree. The doors open up for a lot of more opportunity when you are a registered nurse or a nurse practitioner or someone of a higher degree, and really a higher degree level. And the doors do open up, the pay opens up, your opportunities are more, and if you're a hands-on person, then I can guarantee you, like, an MA is not where you're going to want to stop. And that 22 grand or whatever median that your tuition may have fell on, you're going to regret that you spent it on that. Big regret. Because nursing school is not cheap. I'm currently enrolled, and when I look at my payments a month and I see what I have to pay back, y'all, it's crucial. But it's worth it for me because I like hands-on and I love my patients and I want to do more and I want to impact the healthcare community as big as I can. Like, seeing this outbreak, we wish that we could be out there helping, but we're limited because of our education.
Because we are MA and they don't want MA, so we have to have put in this video for y'all. So we're here.
Facts.
But drop some more questions, like real questions in the comments we can answer. This video is just like a broad video, so, and just how we feel basically. But if y'all have like specific questions, like I know that blood question, I used to get a lot of those blood questions about blood. Yes, you learn that in MA school, and depending on where you go, it's either you do it or you don't do it, or you do it sometimes or you do it all the time. So
and alongside with that, some schools do allow you to get your phlebotomy cert. So some schools allow you to get mini certs while you're still achieving your MA, your medical assisting degree. For those that go out there and get your associates in medical degree in a medical assisting, that's amazing to you, because I wouldn't do it. But
no cap, it's really no point in that, because they don't even look at that. As long as you are certified,
that is really the question.
All they care about.
That is truly the question. Are you certified? They don't care that you have an associate's or bachelor's. To me, that's a waste of money. You went and put like another 15 grand on an associate's degree,
and they don't care.
And they don't care.
Your little certificate is up to date and you're good with your CEs, then,
because I guarantee you, it's still not going to let you participate in this COVID. I'm not saying there's anything wrong with having your associate's degree. I'm just saying that, like I said, like we said,
assistant degree.
If you want to be proactive, nursing is where you want to go. That's where you want to stick with. That's where you want to put your money to. But if you because we didn't know any better. We just did it because we were right out of high school, and this was something to just get us in because we wanted to be in the healthcare field.
And I hated prerequisites. And the school we went to, it was no prerequisites. So
you just hopped right on in.
Sold.
And let me tell you, don't be conned by those advisors, because they'll pretend like they care for you, and then all of a sudden,
after month one,
they're gone. They just wanted to get you in. Ultimately, you are like...
I have a story about that. I want to talk about that. But I went to the school that we went to MA school with.
We can't say the school name. Probably not.
They probably come for me. So I went, because she probably know exactly who I'm talking about. So I went and I had a
what was the name of your lady? Maybe we have the same lady.
No, this is before her though. This is before her. So I had went and I had toured the school with her and everything. I had got the paperwork and everything, and basically I dropped out. Like, I wasn't ready for it. I didn't think I wanted to do it, and I didn't tell the advisor, but I didn't think it would be I didn't think it would be like it mattered. But when I was ready to go back, do you know this lady did not answer me? These advisors only care if they're getting money. And I did not get her any money because I didn't go through with it. So I had to turn around and get a whole nother advisor. And the advisor was sweet until month one. And I didn't hear anything from that advisor. So for real, don't be kind. Some might care, but 9 times out of 10, they're there for the money because they have to get money based on how many people they enrolled. And I messed up sis' paycheck and she made me pay for it. So
how many bodies are in that seat is what matters. Not about if it's the best for you, because they'll do anything to get you enrolled. They'll pass any hoops to get you enrolled. And that's the thing that you have to look at. Like, is it really about your education, or is it like for money? Are they a non-profit or are they for profit? Like, these are all things to look at when you're looking at a school like that.
And I should have went with my first mind, but
we just wanted to be
so hooked on no prerequisites, and I could be in the medical field.
What, 13 months?
No, it was a year program. Ours was a year.
Are you
but
sure?
the other school, the other schools was like 8 months. Oh. But we did extra.
Good teachers though.
It's a okay school, but I could have learned it for less than.
Everybody and their mom is a MA, so we're not in demand, and that's why we get paid what we get paid, because we're not in demand. But there will always be a need for doctors, nurses, PAs, LVNs, nurse practitioners, that field will always grow, because look at our world. Look what we're doing to ourselves. Look at how we're eating. We're always going to need healthcare, and healthcare will always be expanding. So,
and especially because I just read earlier that COVID people are actually like getting it twice. We not gonna be at the house no time soon.
Y'all, 5G.
All right.
I really wanted to say that.
But yes, they have had people in South Korea get COVID again for the second time. And Texas really think they finna lift the law and we can go outside? I'm not going outside.
You know Abbott, he don't care.
I'm not going outside. Natural selection, I'm not going outside.
I'm staying in.
Even if they lift this little man.
I'm not meeting anybody.
I'm not going outside. You're not gonna get me.
First of all, she's only in here because she only been at her place. But we really are keeping our social distancing. I mean, she only really been by herself. That's why I let her in. But
ain't even been to work and see nobody. So,
and we've been here by ourselves too. So
yeah, they'll go outside when they lift this ban. It's really natural selection at that point.
They were really trying to get rid of you, and y'all want to hear it. She said not to say it. It's the 5G.
Okay, all right. But y'all see, the weather is getting cold. COVID is going to thrive in this cold weather. It was hot for 2 days. It was hot.
Well, they even said that COVID, the hot temperatures will not reduce the virus.
But they said it kills it.
No, it doesn't. That's what they were recently talking about, that even though there's going to be hot weather, that's not going to reduce the virus, because they've already seen it in places like Australia where it wasn't reducing. So y'all just stay inside, and if you don't have to go outside, then don't. I mean, you can go and jog and get your exercise, but just remember that if someone coughs, it does stay in the air for 3 hours, so you can inhale and then potentially get sick. So probably the best thing to do to avoid the number increase is just to stay inside. Go get some food, cook your own food. Look, that is some doo-doo.
Facts.
Look at that.
Because that's why I wear my
Maybe
glasses
clean it
so
out.
y'all won't see my eyebrows, because they're really a mess. But you know, at this point, we're all quarantined. Like, my hair really needs to be done, but it's okay because nobody is seeing me and I'm not seeing them. So y'all can see how my eyebrows look. I need my eyebrows done, my eyelashes done, my hair done, my nails done. Like, I just need it all. Like, I'm really going through it. And even if they open up the outside next week, I still won't be there.
I'll tell you what, I'm not either, because the first wave of people that goes out there, I guarantee you they're going to get sick. And that's why, you know, like, to flatten the curve, we all really should stay inside. You okay, guy? No matter what they say about you not being able to get sick or whatever, just stay indoors if you don't have to. I'm really hoping that things will get better, because a lot of people are out of work, and we have bills to pay, lights to keep on,
Rent to pay.
and I'll tell you what, these companies do not care, and they will turn your shit off. So I do hope that things get back to somewhat normalcy. That way we can be able to pay our bills, and she can keep making videos.
Because if AT&T turn my stuff off, then that's just it.
It's a wrap.
That's just it.
It is a wrap, y'all.
So thanks for watching this video. Comment below what else y'all want us to talk about specifically. And that's it. You want to tell the people bye? Oh, you ain't got nothing to say now. All right.
Look at this little 1 tooth.
All right. We out. Bye.